Hello, my name is Chris Lathan, and I am a friend of Farber Street. I'm a medical oncologist, and I've been working with Stan to put a program together, but the program that we're most interested in today is right before you. And I really look forward to hearing more from our esteemed panel about their work and how it's critical to the strength of overall public health in our society and how it influences policy going forward. And really, there's a great synergy with, even though everybody's in different disciplines, great synergy with the work that they're doing and even my own work that we've done in the community. So I'm really excited for these conversations, as I'm sure you are too. So without further hesitation, we're just gonna go ahead and jump right in. And what we're gonna do is we're gonna ask our panelists, tell us a little bit about yourself and what you're passionate about. And we'll go ahead and start with Dr. Love.
Hi, Chris. Thanks for the opportunity to be here again. Well, my background is I grew up in the South. I grew up in Huntsville, Alabama. Lately, with all the social justice things go on, I remind people that I actually grew up in the Jim Crow South. I trained in the Northeast, as I mentioned, went to medical school at Yale and did my after medical training at the Mass General. I came to industry about 30 years ago and have mostly focused my life on trying to make innovative therapies for serious medical problems in cancer, heart disease, and now my passion is really sickle cell disease because it's been underinvested in. And as a Black physician, particularly somebody running a company, I thought it would be great for us to focus on that. And I'm very proud of the success that we've made in collaboration with many organizations around our country.
And so first of all, I just want to say tremendous work before we go on. And we're going to circle back, as a physician of color and how all this impacts, our approach to our patients, the impact that we have on our different societies. But I just want to say, and I'd heard about you before I met you, so your presence preceded you. I'm going to move forward to talk to Pamela Everhart. Tell us a little bit about yourself and what you're passionate about.
I'm head of Regional Public Affairs and Community Relations at Fidelity Investments, and I happen to also grow up in the South. I guess Southwest. I grew up in Texas, a very humble growing up period. My team and I at Fidelity work on advancing public policies to support our customers, but we focus on savings and healthcare policies. One of the most rewarding and I think fulfilling part of my role, and something about which I'm passionate, is driving opportunities for my Fidelity colleagues to use their unique skills and experience and knowledge to support underserved communities. And we focus on financial literacy and closing the wealth gap and improving racial equity and social justice. More disposable income can lead to more of an opportunity to afford quality health care for you and your children and your families. And oftentimes people don't realize that they can save by just starting off small. You don't have to, save a huge amount of money, but it has to be consistent. So I am committed to helping people in my community be more confident and comfortable with financial concepts and making informed decisions so they can save more, so they can provide the things that are needed for their families to grow and live and have healthy lives.
Thank you, Pamela. And I will say, I'm not from the South. I'm local here, but both my parents are from the South. My dad's from Carrollton, Alabama. My mom is from South Carolina. So my summers were spent, like many of us up north after the Great Migration, spent down south. And we're going to come back to some individual questions. Eventually, I will take some chair prerogative, ask you some follow-up questions. But right now, I wanted to hear from Bob Coughlin. Tell us a little bit about yourself and what you're passionate about.
But thank you, Chris. I'm from the south part of Boston, just south of Boston, in a town called Dedham, Massachusetts. And if you can tell with my accent, I'm not from the south at all, right? But it's great to be here. And my passion, people always say, why are you so passionate about drug discovery? And as the CEO of MassBio, it's my responsibility and MassBio's responsibility to make sure that Massachusetts remains, the best, or one of the best, if not the best places in the world for the life sciences. And that, I didn't choose that passion. It chose me in a sense that, I'm a recovering politician. And when I was running for the House of Representatives here in the Commonwealth of Massachusetts, over 18 years ago, my wife and I found out that we were going to have a child with cystic fibrosis. And as you can imagine, that changes how you look at life, right? And I'm an engineer by degree, went to a Merchant Marine Academy, worked in environmental services, and decided to get into government. How do you end up not being a doctor, not being a scientist? How do you end up heading up an organization like MassBio? Well, my goal 18 years ago became to get up every day and do whatever I could to try to change Massachusetts so that my son and anyone else who is sick had the best chance of having some of you amazing physicians and scientists be able to do the work that you do so that we could solve unmet medical need. So yeah, for me, it was cystic fibrosis. But there's all sorts of unmet medical needs that do better when we create that environment. It really came down to getting academia, industry, and government to work together. Because when industry, academia, and government work together, there isn't a problem you can't solve. And Massachusetts is the best place in the world for that camaraderie and for that teamwork and for that collaboration. And it's so important that we continue to do so. Just personally looking at where cystic fibrosis research has come in the past 18 years, I mean, I don't have nightmares about my son dying anymore. Just a few years ago, I used to. And to think that for over a year now, he's been on a medicine that took 18 years and $13 billion to invent, but the course of his disease has changed direction. His lung function is getting better, not worse. And, you know, if we can do that for every unmet medical need, think of how important that is. And when you think of healthcare disparities, why in the world wouldn't every single patient get the same treatment no matter where they're from, no matter what their parents do, or no matter what color they have, right? So that passion really comes from experience the best treatment in the world that my son has gotten. I want every patient in the world to get that. And I can't think of anything that is more important to be passionate about than that. And that's what Harvard Street is all about. And that's why we're all here today, celebrating Harvard Street.
Wow. First of all, Bob, I want to say thank you once again for talking about and sharing what you've gone and what your family's gone through with their own health experience and your passion and your enthusiasm for not only taking your individual great experience and your prayers always to your family, right, and your son's health experiences, but thinking about this broader and thinking a little bit about the broader community and thinking about this and how, like you said, your zip code, your income, your skin color, the language you speak should not determine the quality of your care. And that brings me to, the next questions for you guys is really talk about community and defining community as to what it means for you all. And I think, we're going to go in reverse order, Bob. I know you just spoke, so we're going to hit you again and talk about community. And then we're going to go back and then we'll go to Pamela. So tell me what community means to you, especially in the context of this, talking about equity and
Yeah, and you know something? It's all about community, right? And when I think of personally, right, and what has given me the outlook that I have on life, if I didn't have the cystic fibrosis community early on and my son's diagnosis, I probably would have been curled up in the fetal position, depressed somewhere, or drowning my sorrows with alcohol or something. If I didn't have those people to help lift me up when I was down, I wouldn't be where I am today. So when you think of, to me, the community was folks from the cystic fibrosis community, folks from Boston Children's Hospital, the medical community, the scientific community, the philanthropic community, people like Joe O'Donnell, who lost his son to cystic fibrosis, that came to me and said, let's go raise money and invest in research so that your kid doesn't die like my kid did. So community to me is everybody taking care of each other. It's not about us doing better than them or this or that. It's about everyone, because we're only as good as that lowest common denominator. And going back to saying, when I was in elective office, what would drive me nuts would be to think that my kid could get better care than someone else's kid. Not cool, not good. So for me, it's about community, and it's about people taking care of each other, people caring about each other. It's about civility. Couldn't we use more of that in our world right now? Well, that's what community is all about. Community is a wonderful word. It's a powerful thing, and it's so important for all of us to do better together as a community.
Thanks, Bob. That's great, right? Community versus exclusion, right? We want to, kind of move towards that. So we go to Pamela Everhart. And in that same question, tell me about community and what community means to you.
Well, for me, because I focus a lot on the kids, that's the first place I go to. Because I think going back when I grew up and being uncomfortable with finances, I didn't grow up where we were talking about stocks and bonds or even Bitcoin right around the dinner table. And I was a little hesitant when people would start talking about it. And actually, my first job, I was even afraid to invest in the 401k. I mean, because I'm not sure what this is all about. I didn't understand saving versus investing. My mom, when we were kids, she was so good, like a lot of Black moms, they are the CFOs of their families. So they're really good about saving. I mean, they can make, a penny go a long way. But what she wasn't good was in investing, and helping her, making her money work for her. So my community has really been about seeking out underserved schools in the Boston area and making sure that those kids learn. And just one quick story. I was doing some financial literacy training at a school in Roxbury, Orchard Gardens, and there was a little boy by the name of Marlon, 12 years old, went through the program. And at the very end of the program, he says, "I'm so excited." And I said, "Why are you excited, Marlon?" He said, "My mom just got a job. The first time in my life that she's gotten a job." And I'm like, "That's great." And he said, "I took her down to the bank so she could open up a checking and a savings account because she had never done that before." And then I told her, I said, "Mom, when you start on your job, the very first thing you need to do is ask about their 401k so that she could start saving." So for me, just these kids, getting them when they're young can make a difference in their families. And that's what I'm hoping to accomplish.
That's fantastic. And I just want to add, my mom, as you point out, is definitely the CFO of the family. Me and my brother and my sister would always say, Mom would give you her last dollar. And that's true. But unfortunately, it really was her last dollar. And I think, we didn't learn, and that, we were lucky enough to, even when you're lucky enough to go get education, you didn't learn how to manage your money because my mother never knew and her mother never knew. And so I wish we had your class then, and I hope further generations will be able to take that. Heck, I might come in and drop in myself just to get some pointers.
You're welcome.
And so, Dr. Ted Love, also coming back to that community question, tell me what community means to you?
Well, first of all, I do want to acknowledge what Pam said. Pam, I think you knew my mother in terms of being able to stretch a penny so far. But there was no concept of investing in our family. And I really do wish that my parents had the benefit of knowing someone like you and what you're doing at Fidelity. That's so important. Chris, for me, community is all about coming together to achieve something much greater than we would achieve as individuals. In fact, if you read Socrates, one of the things that you recognize is the whole benefit of a civilized society is to come together and not focus on yourself, but focus on everyone else. And by doing that, we all benefit extraordinarily. And so community for me is really about us coming together, whether it be a sickle cell community, whether it be an African American community, or whether it be us as a United States community. We should really be coming together to help each other, and by doing so, we will all be extraordinarily more successful.
Well said. Thank you for sharing that, Ted. I think, and I want to take the opportunity to turn these questions a little bit and talk about Farber Street. And so the order today, just so you order for this question so you can get prepped, it's going to go Pamela, then Ted, and then Bob, just so that you know. So Pamela, what do you hope to accomplish this year at your company and your organization in the community that will better support the underserved clients served by Farber Street Neighborhood Health Center and other community centers like it?
Sure. You know what? A lot that I want to hope that I accomplish at Fidelity, but I just like to, for a moment, just focus on another initiative that I'm involved in. And I'm one of the 19 Black co-founders of the new Commonwealth Racial Equity and Social Justice Fund. The mission of this fund is to provide essential support and resources and thought leadership to uncover and dismantle racism in institutions in Boston and across Massachusetts. The fund focuses on four pillars: policing and criminal justice, healthcare equity, economic empowerment, and then youth education. And my hope is that this fund is successful so that we're able to fund nonprofit organizations in the community like Harvard Healthcare, Harvard Street, who are focused on the work, who are focused on making sustainable change, and who are making a difference. And so that's how I hope to spend my next several months, is trying to get a lot of people engaged in this work so that we can fund these nonprofits. Because with COVID, I'm not sure if all of them are going to survive. And without our collective help, they may not.
Thank you, and thank you for bringing that up. And I think, one of the things that all of us who've been in the community work, it's been a scary time because of COVID, and so we want to make sure that folks who are in the work, been doing the work for a while, can have the opportunity to thrive. And so that is fantastic. And then I think I said I was going to go to Ted Love next, right, and talk a little bit about what you hope to accomplish this year, and to better support underserved clients, like Harvard Street or others, if you want to talk about that as well.
Well, first of all, I'll say one of my new goals might be to get involved with Pam and this initiative that she started, because I think the pillars that she laid out really are extraordinarily important, and they are the right ones that we should be focused on as a nation. So that was very inspiring to me. As a company that just got a novel therapy that we think is disease modifying, very similar to what Bob is talking about for cystic fibrosis, I'd like to see every patient in this country offered a chance to receive that therapy. The Food and Drug Administration approved it for everyone with sickle cell disease older than 12 years old. And in our country, unfortunately, I don't think we have the sense of urgency that we have, Bob, in cystic fibrosis in the sickle cell community. So this has nothing to do with revenues from my perspective. This has to do with, you go out and you invent a great therapy, the Food and Drug Administration approves it, but it's got to be offered to individuals. We're doing very well. About 4,000 of the roughly 100,000 patients in the U.S. have been offered that therapy, but we need to do much better than that. We need to make the therapy offered broadly. I think probably between 85 and 90% of people with CF are on the kind of therapies that Bob's talking about, and they are having dramatic outcomes. So my goal is going to be to make sure that we continue on our mission to make more therapies, and we continue our mission to make sure that patients in the United States are made available of the new therapies that have been approved, and supporting their utilization.
Yeah, there's nothing like that. They talk about that T4 problem, like the transition of the technology. We always in oncology we talk about going bench to bedside, right? Well, then there's bench to bedside, and then there's going really from the bedside to the community. And I would even say going from the community to vulnerable communities, because sometimes there's some communities that come before others. Well said, Dr. Love.
And Chris, I'll just add, and partnering with the communities is a critical part of what we do. I'll just mention that we got a call in March, right when COVID broke out, from the Sickle Cell Disease Association of America saying, we'd like to raise $100,000 to try to help sickle cell communities across the country, because we know they're going to be under great distress in this pandemic. Our response was, here is $100,000. Your campaign is done. So we expect to continue to try to do that and to support our organizations, because again, it boils down to the community. We've got to be invested in helping each other if we're going to make the kind of change that everybody on this panel is trying to drive.
Yeah, well said. All right, Bob, tell us a little bit about...
I'm chomping at the bit right now, because Ted, you just set me up for my answer, because I'll tell you what we're going to do at MassBio. We're going to continue to provide services for underserved clients and patient population by leveraging MassBio's influence in our platforms, right? We have our State of Possible podcast, our events, our blogs, etc. We're going to continue to educate the community about these pressing issues, which including health inequities. Why? What's the sense of doing the research that we're doing to invent these drugs if folks in the sickle cell community can't access it? So what we really need to do is take our state and federal policy agenda, blow up this sick care system that we have, and turn it into a healthcare system where patients can access these breakthrough therapies. Think about it, folks. We're inventing therapies that change the course of disease and in some cases cure disease, yet we have a payer system that is designed to pay for chronic therapies, right? It's not the payer's fault. We need to come up with a better system where value-based payments are accepted. So, when you look at all these disparities, whether it's for underserved communities, rare genetic disorders, we need to fix that through state and federal policy. We also, in our end as an industry, we need to diversify our clinical trial participation. We know what the barriers are, folks. Let's bust them down so that the patient population in clinical trials can look like the patient population that we're going to serve. We've done horrible, and it's not accepted anymore. And then workforce piece, guys. Like when you look at our pipeline of future employees, people always say, well, equity, diversity, inclusion, yeah, it's the right thing to do. It's not just the right thing to do, it's a good business decision. It's a statistical fact that the more diverse any group is, the better the outcome is going to be. That's scientific fact. So if we don't form partnerships with historically Black colleges and universities and Hispanic serving institutions, tribal colleges and universities, these are all things we're doing at MassBio so that we can diversify our pipeline so that we can stay on top and continue to be the best. So I'm sorry, I just got really excited there, but what Ted was saying, yeah, I couldn't agree with you more, my friend, and I can't wait to work with you, next year and the years to come to make sure that the sickle cell community gets the access that they deserve.
Ah, man, I think you're about to start preaching. I like that.
I can't help it.
Yeah, no, I hear. So I know we could have this conversation for another hour, but unfortunately we can't. So what I want to do right now, and I want us to kind of we're going to sum up a little bit with just one question, and then we will sadly have to end the panel. But for each of you, I want you to give me one or two things you'd like to focus on in the future. Just and as succinct as you can. I know it's a big question, but let's give you that, and that's something that we could think about for the future. What should we focus on? So I want to start with Pamela. Tell me if you could pick one or two things you'd like to focus on in the future that would improve life for poor communities, specifically Black and brown folks throughout the U.S.
Yeah, I will be quick and give you one. I talked earlier about supporting nonprofit organizations. The other thing that I think we need to do is to support Black and brown businesses. And one thing that we're going to do at Fidelity is double our diversity spend in the Black and brown communities, because support of these businesses is even more important during these times. So that's what I would challenge everyone to do. Support your Black businesses.
Well said. Dr. Love.
Similar. I would focus on equity. This country has dug itself an enormous hole, and some people are trying to dig the hole even deeper. But the way that this country is going to be tremendously strong and achieve its great potential is being equitable. Because when you're equitable, you get the best outcomes for everyone, and you get the strongest nation overall. So I'm very focused on equity, whether it be in education, whether it be in jobs and opportunities. We've just got to make our society more together and more focused on equity for all.
All right, Bob, you get one last line in here.
Yeah, I want to talk about the workforce piece and creating an on-ramp for first-generation college students from underserved communities so that they can get the summer intern jobs at all these amazing, we represent 1,400 life science companies here in Massachusetts right now. Let's continue to build off of Project On-Ramp, which we started with Life Science Cares, Massachusetts Life Science Center, MassBio Ed, and MassBio got together and got our member companies to offer up these summer internships, partnered with Bottom Line, and we're plugging young adults, amazing students that never would have known what the life sciences industry was if we didn't create this on-ramp. And I think that's a great way to promote equity, diversity, and inclusion, and also give us that pipeline of workers of the future that we need to stay on top.
Well, thank you. And again, this is not enough time, but I do want to say, first of all, thank you very much to our awardees. As you can hear, everybody's doing tremendous work. And I just want to say it's an honor to just be a part of this panel and to talk to you all. And I would love to follow up at some other time. I also want to thank not just our panel, but all the sponsors who made this possible. And we look forward to these, not just conversations, but action and accountability going forward, right, in all of our actions in the future. So thank you very much for your time. And we're looking forward to the plans to make things better, more equitable, and certainly more reach for those poor, vulnerable patient populations.